Hi, I'm Dr. Bill Barrett, an orthopedic surgeon at ProLiance Orthopedic Associates. If you're watching this video, that means you've either scheduled surgery or are planning to schedule surgery here at Valley Medical Center. And I'd like to, for the next couple minutes, just in broad brushstrokes, describe what goes on in the operating room. First, you come to the hospital, you go to the pre-op area, meet the anesthesiologist. After that's done, you'll be brought to the operating room. It's a big room, a lot of white tile and sterile, and that's because it is sterile. This is where we perform surgery. Now, you'll see a lot of equipment. This is the anesthesia machine that monitors your vital signs during surgery. Most patients will have a spinal anesthetic and then sedation, so you won't be hooked up to a machine per se for breathing. You'll be breathing on your own. You'll see sometimes a special table. This is a table that we use for anterior hip replacement. If you're having a knee replacement, it's more of a standard operating room table. So who's in the room? Well, the surgeon's obviously here, his physician assistant, who you'll meet soon, a circulating nurse who makes sure everything is going well with you during the operation, and then a scrub tech who will pass us instruments. We use a variety of standard and specific instruments for joint replacement. You'll see an array of specialized equipment that allows us to accurately and efficiently perform the operation. The surgery generally takes about 1 to 1.5 hours to perform. At the conclusion of the procedure, you'll be taken to the recovery room. My assistant, Jana Fleener, who is a physician's assistant here at ProLiance Orthopedic Associates, works with me in surgery, as does all the orthopedic teams. And I'll have Jana describe to you what goes on after you leave the operating room.
Hi, I'm Jana Fleener. I'm a physician assistant. As a PA, you have most likely already met myself or one of my colleagues during our new patient evaluation or during your history and physical in preparation for your surgical procedure. My role is to assist the surgeon during the surgical procedure itself, as well as to help take care of you while you're on the Joint Center here at Valley Medical Center. Once you have left the recovery room, you will be welcomed by a Joint Center staff member at your room. Once settled there, a nurse will be in to review with you your past medical history and pertinent medications. Shortly after that, the therapist will arrive and will get you up on your feet and get you moving. If you've had your knee replaced, one thing that we have a race in time over is to get the flexibility back in your knee. So we'll be working hard on getting the motion back. We will have a full array of pain medication in order to help assist you during your recovery process. We anticipate that you will be with us overnight, one night, and home the following day. What does that look like to us? Well, with the assistance of a walker or crutches, we anticipate that you'll be able to get in and out of bed on your own, to the bathroom on your own, walking up and down the hallways, as well as climbing stairs. Once you've accomplished these goals, we feel that you will be safe to leave for home. Either myself or one of my colleagues will ensure that you have the appropriate pain medication to go home with. We also want to make sure that you have your physical therapy already scheduled. That will be a very important portion of what you will do at your discharge.
Most people are not experienced in having surgery, which is a good thing. And so there's a lot of concern and even downright fear about the unknown. And so I think what we'd like to do is address some of the issues that seem to scare people prior to surgery. And I think certainly one is pain control and how I'll be able to deal with the pain. And number two, how am I going to do at home? I don't feel like I'll be independent enough. Jana, why don't you talk a little bit about what it looks like when patients go home after their overnight stay in the hospital as far as their pain management is concerned?
We use a variety of pain medications such as Tylenol, or there may be a low-level narcotic that we use as well.
You know, in many ways, it's like ordering from a menu at a restaurant. You start out with an appetizer, which we could think of Tylenol, a salad, which could be the oral anti-inflammatory medication, then the main course, which will be some type of pain medicine if necessary. The bottom line is we use a variety of medications that is often described as multimodal pain management. Now, as far as getting along at home, Jan and I both recommend that you arrange to have somebody stay with you that first week at home. While you should be relatively independent as far as walking around with crutches or a walker, you will want somebody to help you out with food, meals, things like that. And so, Jan, I think typically you make a point before surgery to emphasize to have somebody around the first week after surgery and make sure they have rides to get to and from therapy.
Yes, it's very important. And most therapists are quite busy, so it's important to get that appointment scheduled now. We anticipate that you'll be doing a lot of the exercises on your own at home, and then following up with a therapist to ensure that we're reaching all the goals that we have set out for you to reach.
And so the time to make those preparations is now, before surgery. You don't want to wait till you get to the hospital. So it's really important we work as a team to make sure that you have everything you're going to need after surgery at home as far as therapy, help, etc. Another concern patients have are the potential for complications. While our complication rate is very low here at Valley Medical Center, it's something that's in the forefront of our mind. People worry about infection. We do a variety of things to decrease the risk of infection. These start before surgery, which includes special showers 3 days before surgery. You'll have a special skin prep when you arrive here at the hospital. We use IV antibiotics, appropriate operating rooms, and special techniques. In addition to that, people have concerns about blood clots. Jana, maybe you can outline what we do to minimize the risk of blood clots.
Well, if you've not had a previous history of a blood clot, we will use low-dose aspirin, which is 81 milligrams of aspirin. We'll do that twice a day. We will have what we call sequential compressive devices, which are squishy booties that will be on your lower extremities to help prevent blood clots. Plus, we'll get you up with therapy right away.
And with knee replacement, one of the things that we are concerned with is making sure you get range of motion early. And so it's important while in the hospital to start moving your knee right away after surgery. And then therapy can assist you after you go home from the hospital. And Janet, maybe you can just outline what therapy looks like for a knee replacement.
Well, it'd be important to really work hard on getting full range of motion. So 0 degrees extension is where your leg is completely flat, as well as making sure that we're able to bend your knee to at least 120 degrees. This will require quite a bit of work on your hand, in which you work on your own at home, 3 concentrated efforts every day in which you work hard on range of motion. Controlling swelling actually helps improve your range of motion quickly, so that's going to be an important point of going home, making sure that we're icing and elevating your leg.
With hip replacement, therapy is sometimes not necessary, but it's important for you to be up, walking around, moving your new joint. So the key is the first week or 2 at home, take it a bit easy, but be up, moving around, and minimize your risk of complications.
We would like to thank you for the privilege of being able to take care of you here at Valley Medical Center. We believe that you will find your experience exceptional.
In the next segment, the nurses are going to describe what goes on the Joint Center following your joint replacement surgery. And again, thanks for allowing us to share in your care.
Hello and welcome to the Valley Medical Center Joint Replacement Seminar. My name is Katie. I'm a nurse here on the Joint and Spine Unit, and we are thrilled that you have joined us and chosen to have your surgery here at Valley Medical Center. The purpose of our seminar is to go over what to expect while you're here in the hospital, also what to expect pre-op, during your hospital stay, and then to prepare you as you go home for your discharge. Our seminar goals are we want to provide you information to prepare for your joint replacement surgery. We want to ensure a smooth transition from the hospital to your home, help you achieve maximum benefit from your new joint replacement, and if we were doing this live, we'd have an opportunity to ask questions. As you know, probably very well, arthritis affects more than 40 million Americans, or 1 in 8. It's the leading cause of disability in the United States. Diseased or injured joints rob people of mobility and independence. Joint replacement surgery restores the joy of motion and allows you to get back to doing the things that you love most. While you're here, you can expect a 1-night stay for an anterior hip replacement, and possibly most total knee replacements will be a 1-night stay. If you're having a hip replacement, posterior approach, which is from behind, you can expect a 2-night stay. For example, if you have surgery on Monday with an anterior approach, that's the front hip, you will go home on Tuesday. Same with some knee replacements, you'll go home on Tuesday. And for posterior, then you would go home on Wednesday. We here at the Joint Center have a highly specialized staff devoted to caring for you. A lot of people who work here, a lot of the nurses, physical therapists, nutritionists, people you're going to see during your stay have worked here at Valley for many, many years. Many are ortho-certified specialized, and we take great pride in that and providing the best possible care so that you can get off to a good start with your new joint replacement. Our visiting hours are open. We are open 24 hours a day. Please remember, though, that visitors do need rest. An important thing to note is that children under the age of 18 need adult supervision at all times. This has been a problem in the past. Grandma and Grandpa sometimes do provide childcare for their lovely grandchildren, but while you are here in the hospital, there needs to be other arrangements for that. You will be in no shape to take care of your grandchildren while you are here. If you would like, in our rooms, some of our beds do pull out, or our couches, pull out into a bed. So if you'd like to have someone stay overnight with you, that is a possibility. While you're here, you'll just need to talk to your nurse about that, and we can set that up. Here on the Joint Center, people ask us quite often about long-distance phone calls. We're unable to bill them. You can use a calling card or bring in a cell phone. We have cell phone service here as well as Wi-Fi, so feel free to bring in your laptops or tablets. Please note that we are a smoke-free campus, so if you are a smoker, you will want to talk to your provider prior to surgery to discuss the possibility of a nicotine patch to help you get through your stay. Once your surgery has been scheduled, the hospital's pre-registration staff will contact you and get your personal information. A pre-op nurse will interview you by phone or in person to gather pertinent medical information for your hospital stay. We ask you to evaluate your home prior to surgery. We will ask you lots of questions while you're here, especially our physical therapy staff, to ensure that you have a smooth transition when you get home. Think about your house. Do you have stairs? How many stairs do you have? Do you have stairs leading up to your front porch? Do you have stairs from the garage into the entrance of your home? And then also stairs going up and down in your home. You'll also want to think about, do you have handrails? Handrails are very important as well. You want to take a look at the way your home is set up. Are there throw rugs on the floor? Are there loose cords? You're going to be walking around with decreased mobility. Throw rugs are a real fall hazard, and we ask you to remove those prior to surgery. You're going to need medical devices, and we advise you to try and get them prior to surgery. Most likely, you will need a front wheel walker or crutches. You can see this gentleman, he has his walker kind of jazzed up. The typical kind of walker that we want for you is the one without the seat and without the brakes. We like just this simple front wheel walker, and the reason being is that it provides the most stability. The ones with the brakes in the seat, while convenient, don't provide stability since you're worrying about putting the brakes on. So we do ask for a front wheel walker. Some people also like crutches, and please note that eventually you will transfer over to a cane. One other thing about your home is if you were to look in this left-handed picture, the furniture requires a lot of maneuvering. It may be easier to rearrange your furniture in your home so that you aren't having to walk around furniture when you're trying to recover. Let's see. Oh, this is a key piece. Plan to have someone stay with you for the first week after surgery. You are going to most likely be taking a multitude of narcotics, well, one narcotic, as well as sometimes muscle relaxers. This can be confusing. There'll be other medications that will come. You're going to be experiencing pain. You aren't going to be as mobile as you were prior to surgery. You need to have someone who can be a full-time caregiver for you. All right, preparing for your surgery. Pack your personal items, things that you'll need. Perhaps a robe, loose, comfortable clothing, shorts, like loose type basketball shorts, or women, I see a lot of women who do like a loose sweatpant or a loose capri pant. Footwear, things that are easy to get in and out of and also provide good traction. And then we also ask you to please bring in any of your prescribed medications in the original bottles to the hospital. While you're here, we will provide you with your medications, but it's helpful to have those medications in the bottle so that we can verify the dosage and understand what you're taking at home to ensure a smooth transition while you're here. The other key piece to that is that it's great if you, before surgery, can write down what you take and when you take it. Write down the dosage and what time of day you normally take that medication. As far as your annual flu shot goes, we want you to talk to your provider. In some cases, we may not want you to have the flu shot prior to having a joint replacement surgery. That goes for the pneumonia vaccine. It is okay to get the pneumonia vaccine, but we don't want you to get the pneumonia vaccine 3 weeks prior or 3 weeks after your surgery. All right, getting ready for surgery. You'll be issued a special pre-op body scrub by your physician with instructions how to prepare for your surgery. Please do not shave your legs or affected leg, prior to the surgery. We have a specialized team down in our pre-op area who will prepare your leg by shaving it with a special razor to get ready. When you do it at home, you raise the risk of having a nick in your skin, which can be an opportunity for infection. After you use the body wash in your shower, we ask you to use fresh sheets. And also use fresh towels after your shower, and don't use the communal bar of soap that many people do in their shower. A good question that someone asked me the other day when I was teaching this seminar is, do I need to change my sheets every time? Because it can be up to 3 days of washing your body. And that answer to that is no. Just wash your body before bed, go to bed with, on your clean sheets. As long as you have the clean sheets the first time, you don't have to keep washing them every day thereafter. All right, day of surgery. No food 6 hours scheduled before surgery. So if you are scheduled to be here at 6 in the morning, you need to stop eating at midnight. You are allowed to have clear liquids, and that means water, Gatorade, and apple juice, up to 2 hours prior to scheduled surgery time. So if it's 6, nothing more to drink after 4 a.m. If you have been instructed to take a medication prior to your surgery, it is okay to take it with a sip of water. So that 2-hour window, you may take your medications in that 2-hour window, but just with a sip. Please talk to your doctor about certain medications, especially heart medications, blood pressure medications, certain diabetic agents. And if you have any doubt, please contact your doctor or pre-op nurse. Our parking options, we have valet parking. It's $2 for the day. Just to let you know, we do cash and credit cards, nothing bigger than a 20. And after 5, the valet is open from 5 a.m. to 5 p.m. It's very convenient. It's right outside the facility where you'll walk in for the pre-op nurse. We also have parking in our tower garage, which is right below where we are today, here in the 5th floor at the Joint and Spine Center. When you go in, you'll get a card, and then you'll validate it. It's free. Even if you would come in the morning, you park your car, and your loved one decides to stay overnight, it's not a problem. You can leave the car safely and securely in our tower garage, and we'll validate that card for free. All right, as you come in the door, we want you to check in at our surgery admitting area. It's in the main hospital lobby to the left of the fountain. You can't miss the fountain. It's a big, great centerpiece in our main lobby. You go to the left there, and you'll check in for your surgery. When you check in, you'll get a pager, and we want you to give that to your family or loved one who is going to be waiting for you. During their surgery, your family and friends should wait in the 3rd floor lobby, which is the main hospital lobby right by the fountain. When the surgery is finished, your surgeon will page the family and then meet with them to let them know how everything has gone. After hours, for some reason, if your surgery is really late, there is a phone across from the information desk if your friend's family need to call for assistance. While your family waits, they can track your progress of your status of your surgery on the screens on our 3rd floor lobby. You'll see them. They're right by where the admitting area is. The way for family to watch your progress is it'll be the first 3 letters of your last name, comma, and then the first initial of your first name. And they'll be able to watch you and see you go through the pre-op process, the surgical process, and then they can see when you're out of surgery and recovering in our post-anesthesia care unit. In the pre-op area, you'll change into a hospital gown. You'll wipe your body with a special anesthetic cloth. An RN will review your medical history and shave that surgical site like we talked about before. Your surgeon will come in and initial the site, and we'll have you go to the bathroom before you go into the OR. Your anesthesiologist will come in and determine the best anesthesia for you. There are 3 choices. Sometimes we see a combo of choices. General anesthesia, it combines medications and anesthetic gas. A regional anesthesia, which injects medication into just a certain part of the body. And a spinal anesthesia, injects into the spine and numbs you bilaterally below the hips. Most total knee and hip patients will have a spinal anesthetic in addition to IV sedation. So what that means is that you'll have a spinal, you'll be numb from the waist down, and then you'll have an anesthetic where while it may not be what is considered a total general anesthetic, it will put you out enough so that you don't remember what is happening, nor will you be able to hear, see, or smell anything that's going on in the OR. In the OR, once you're done with pre-op, you'll be wheeled back into the OR. Please know the OR is a bright, cold place. It's also very noisy. Don't be alarmed. The anesthesiologist is going to be with you at that time. You'll be wearing an air temperature controlled gown for your comfort. The anesthesiologist will administer the appropriate anesthesia, and your team will position and prep you for your surgery. Your team will include a surgeon, a surgical assistant, anesthesiologist, nurse anesthetist, an operating nurse, and surgical technicians. There are going to be many, many people in there making sure that this surgery is going well and that you're being well taken care of. After surgery, you'll be taken into the post-anesthesia care unit, also known as the PACU, for recovery. A PACU nurse will care for you as your anesthesia wears off. When you wake up, you should expect an IV, typically a drainage tube coming out of your surgical site, and oxygen. You will probably wake up with an oxygen mask, and then you will most likely transition into a nasal cannula, which is just the two little prongs that go into your nose and provides oxygen. As your anesthesia wears off, you may experience some pain. Don't worry. That's the job of the PACU nurse, is to try and get you comfortable. They got lots of tricks up their sleeve to help you deal with your pain. Additional side effects of anesthesia may include blurry vision, dry mouth, and nausea. Once again, the PACU nurses are well trained in treating these symptoms and helping you feel better. Your anesthesiologist will decide when you can be moved up to your room here on the 5th floor at the Joint and Spine Center. It typically takes 1 to 3 hours after surgery to clear PACU. For example, if you have surgery at 7:30 in the morning, your surgery may take an hour or two, and you may then arrive up to your room here at 11 a.m. Once you arrive here onto the floor, we're going to go with a multimodal approach to pain management. You will have had pre-op pain meds, you will have had inter-op pain meds and an anesthetic, and then once you get to the floor, we're going to transition you to pain pills. A lot of people ask, why not IV meds here on our floor? And the real answer is that the stay is so short that we really need to get you transitioned into oral pain medications to ensure that we find something that works for you so that you go home feeling confident about your pain management. Also, we'll be doing mobilization, walking and repositioning, and ice. Lots and lots of ice. While you're here, you're going to be really tired of us asking you this, but this is what we use. We use this FACES scale. It's a 0 to 10 scale, 0 being no pain, 10 being excruciating pain. I always like to say at this portion of the seminar, while I wish that everyone could be down at a 0, it's really not a reality. You've just had a major surgery. But as a nurse, when I'm out on the floor working there, if I can keep you happy, right here in the 2-3 range, maybe a little bit of a 4, but try and keep it lower at rest, I feel like that we're doing our job and keeping you comfortable. The goal is to have you comfortable, but the reality is that you are going to experience some pain, and we probably can't keep you at 0. I really never want to see you all the way over here. And so this is where I always refer to us as being a team. I'm caring for you, but I need feedback from you so that we can work together to find the best possible pain management solution. All right, managing possible risks. A lot of people worry about infection. You are going to get antibiotics. You'll be getting antibiotics in the OR as well as IV antibiotics up here on the floor. Blood clots is a concern. We will use blood thinners to ensure that you don't experience a DVT. Pneumonia. Pneumonia is common for people when they've been under anesthesia, as well as when they are just lying still and laying around. This is another piece why mobility is so key in getting up and moving, as well as deep breathing. We also have a device called an incentive spirometer that you may be asked to use to help open up your lungs and avoid the possibility of having pneumonia. Constipation, we have a bowel program. This is going to be a big thing you've probably seen in the news or on advertisements all the time. They talk about opioid-induced constipation, and it is a real thing because opiates slow down the motility of your GI tract. So we will be providing you with stool softeners, and then we also have a lot of other stronger laxatives in our nursing tool bag if we need them to help avoid you having a situation with constipation. Hip is a worry, especially a posterior approach for dislocation. We'll be teaching you safety precautions, whether it's your knee, your hip, whatever it is, on how to avoid having any dislocation. All right, rehabilitation. Activity promotes recovery. You will be up and using your new joint the day of surgery. A lot of people find that hard to believe, but typically within 4 hours of reaching our floor here at the Joint and Spine Center, you're going to be up walking down the hall with your new joint. Physical therapy will come meet with you. They are going to focus on mobility, being able to get in and out of bed and walking. They'll teach you some exercises for strengthening and range of motion. They'll also give you a sheet with these exercises so that you can do them at home. And then also stair training. If you have stairs in your home, we want to make sure that you are safe going up and down those stairs before we send you home. You will receive PT twice a day. Now, with that being said, if you come up from the floor at 4 p.m. from surgery, you'll probably see a physical therapist in the evening, and then the next day, you'll see the physical therapist twice. So if you come in later in the afternoon, it won't be twice a day. Now, if you come up in the morning and it's 10 a.m., you probably will see a physical therapist twice. Occupational therapy, some patients are seen by occupational therapy. We focus on the tasks of daily activities, including self-care tasks. They want to make sure that if you have a tub, you can get in and out. This gentleman had a posterior hip, so he can't bend down and put on his own socks. They're making sure that you can use the bathroom, tie your shoes, and teach you lots of tricks to help you while you're recovering from your surgery. Physical therapy. While you're here, the goal is to get 0 to 100 degrees flexion in your knees. Once you're discharged, outpatient physical therapy should begin 2 to 3 days after discharge. Anticipate 2 to 3 sessions per week for 6 weeks. For 4 to 6 weeks, depending on your progress. For a total hip replacement, our goal is independent mobility, walking with a walker or crutches, getting in and out of bed, sitting down or standing up from a chair. We'll work on your safety with your total hip precautions, and outpatient physical therapy, if needed, will start 2 to 3 weeks after surgery. Discharge goals. General rehab goals, so this is from physical therapy, is we want you to be able to walk 150 to 300 feet, independent mobility, getting in and out of bed, getting up and down from a chair, and understand what your home exercises are and have teach back so that you can show us that you know what to do while you get home. From a nursing standpoint, to be able to be discharged, we need to make sure that you can eat, drink, and it says void here. That means go to the bathroom, that's urinate, without any complications. We also need to make sure that your pain is managed with the appropriate medication. Also going home, discharge planning. Plans for going home should begin prior to having surgery. Have someone pick you up from the hospital. Make sure you know who that person is, and also who is going to stay with you after your stay. Please note, you can't drive yourself home from the hospital. Medications. The doctor will write you prescriptions. We have a pharmacy here in our hospital. Most patients opt to use that, so you will be going home with a bag full of medications. During discharge teaching, which the nursing staff does, we will go over all of these medications with you. You're going to go home with pain medications, bowel medications, A blood thinner, for most patients that will be 81 milligrams of aspirin twice daily. For other patients who have a history of blood clots, it may be something different such as Coumadin or Levonormand. And a printout with a list of all the regular medications that you should resume taking after your surgery. Like I mentioned, you'll have an opportunity to fill your prescriptions here at Valley Medical Center. Your nurse will come in and ask you right away, first thing in the morning on the day of discharge, if you'd like them filled. And remember to bring payment for copays if necessary. Medical equipment as needed. You're going to possibly need crutches, walker, and cane, and any occupational therapy equipment as needed. If you do need occupational therapy equipment, our staff will provide you with a list of what you may need, and then also give you some options of where you can go and either rent or purchase these items. I wanted to point out, this is the type of cane, the type of walker that we ask you to get. I mentioned earlier that we don't want to have a walker that has a seat. So this is a standard front wheel walker, all right? All right, follow-up appointments. You will follow up with your surgeon or his PA typically 10 to 14 days after surgery. You'll be seeing an outpatient physical therapist. Knee replacement, please schedule for 2 to 3 days after discharge. Hip replacement may begin about 2 to 3 weeks after surgery. We do here have a Valley Medical Center anticoagulation clinic if needed. This is for patients who may be going on to Coumadin, also known as warfarin, or some other kind of blood thinner. You'll schedule your first appointment here. We'll do that, help you do that here at the hospital, and be provided with information for that location and follow up during your stay. And that's the end of our Joint and Spine seminar. I appreciate you joining us, and we're excited to see you and looking forward to a successful joint replacement.
Hi, I'm Melissa Graves, the manager of the Joint and Spine Center. I want to thank you for watching the seminar today, and I want to let you know that we're dedicated to providing you with quality, excellent care the entire duration of your stay here at UW Valley Medical Center. Thank you.